years, 6
10
years?
years.
Oh my God.
10 years. And after 10 years, I finally was able to get a diagnosis, and that's when they finally told me that I had Alzheimer's disease.
So the effect on your family, it's cruel and unusual punishment. Your family was affected by this too, I think, in a negative way.
Of course. I mean, you know, this is devastating for any family to get this. I mean, you know, once you learn what this disease means to you, and you know, to know that there is no hope. And when I say hope, no hope, there is no hope. It's not like cancer or HIV where people can still live today with the help of drugs. I mean, it's basically what I try to tell people. It's probably the worst way to die.
But Dr. Shnaidman, maybe you can tell us more though. Is there any, what's happening medically? You're pissed off at these people. To me, it's just a throwaway comment. You don't want anyone killed. But what could be done? What's not being done? What's happening?
Are you asking me or him?
Both of you. You can all chime in.
Well,
I'll forget what you
maybe
said.
I could tell you a little bit about the treatments that we have, which
Okay.
are basically nothing. There are a few drugs available. In controlled studies, they are proven to slow down the progression of early Alzheimer's. But as we just heard, almost nobody picks up early Alzheimer's. And to make the situation worse, there are many different kinds of dementia. People tend to call every dementia Alzheimer's, but if you get, you know, a copy of whatever book of psychiatry, there's like 100 different kinds of dementias, which are now called, just to make us more confused, they're called cognitive impairment. So the term dementia is gone now. It doesn't exist in 2015. So if you have somebody who has a problem with cognition, with thinking, you first have to figure out that it's some kind of dementia, which is a word we're not allowed to use anymore. Then you got to figure out that it's Alzheimer's, and then you still got to catch it when it's still early, and then you got to give one of these two medications, which there's basically two, and then you have to see if you can prevent it from progressing. So almost nobody gets caught in that early time. So that's probably something that you found in your journey with this disease.